Which of the following devices is most commonly used in mechanical circulatory support for patients with acute heart failure? A. Intra-aortic balloon pump, IABP. B. Ventricular assist device, VAD. C. Extracorporeal membrane oxygenation, ECMO. D. Total artificial heart, TAH. Answer: B. Ventricular assist device, VAD. Explanation: the ventricular assist device, VAD, is frequently used in patients with acute heart failure as a bridge to heart transplant or to support the heart until it recovers. While ECMO can be used in acute heart failure situations, VADs are typically employed for long-term mechanical support, especially for chronic heart failure patients. IABP is less commonly used for long-term support, and TAH is a more invasive procedure typically reserved for end-stage heart failure. Which of the following is not a common complication associated with mechanical circulatory support systems? A. Infection. B. Bleeding. C. Thromboembolic events. D. Hypotension due to reduced blood flow. Answer: D. Hypotension due to reduced blood flow. Explanation: mechanical circulatory support devices like VADs, ECMO, and IABPs are designed to increase or assist blood flow, and they usually prevent hypotension by ensuring adequate perfusion. Common complications include infections, due to the presence of cannulas or devices, bleeding, due to anticoagulation therapy, and thromboembolic events, due to blood clot formation. Which of the following best describes the primary role of the intra-aortic balloon pump, IABP, in mechanical circulatory support? A. To provide full circulatory support by pumping blood for the heart. B. To oxygenate blood in cases of respiratory failure. C. To reduce the heart's workload by increasing coronary perfusion and decreasing afterload. D. To replace the function of the heart in end-stage heart failure. Answer: C. To reduce the heart's workload by increasing coronary perfusion and decreasing afterload. Explanation: the IABP works by inflating during diastole, increasing coronary artery perfusion, and deflating during systole, reducing afterload. This mechanism reduces the workload on the heart, making it easier for the left ventricle to pump blood and improving oxygenation of the myocardium. It does not replace heart function entirely and is not used for full circulatory support. Which of the following is a key factor that determines the success of mechanical circulatory support using ECMO? A. The duration of ECMO support. B. The patient's age. C. The underlying cause of the cardiac or respiratory failure. D. The level of anticoagulation used during ECMO support. Answer: C. The underlying cause of the cardiac or respiratory failure. Explanation: the success of ECMO is heavily dependent on the underlying cause of the heart or lung failure. If the failure is reversible, such as in acute conditions like myocarditis or severe respiratory distress, ECMO can be highly effective. The duration of support, patient's age, and anticoagulation are important factors but secondary to addressing the root cause of the failure. In which scenario would the use of a total artificial heart, TAH, be most appropriate? A. Short-term circulatory support during a surgical procedure. B. For a patient awaiting heart transplant who is not a candidate for a VAD. C. For a patient with acute respiratory distress syndrome, ARDS. D. In cases of reversible acute myocardial infarction, MI. Answer: B. For a patient awaiting heart transplant who is not a candidate for a VAD. Explanation: a total artificial heart, TAH, is a device that completely replaces the heart in patients with end-stage heart failure who are not candidates for a ventricular assist device, VAD. It is often used as a bridge to heart transplantation when no other options for mechanical circulatory support are suitable. It is not used in conditions like ARDS or reversible myocardial infarction, as those conditions may be managed with other methods of support. Which of the following is a primary contraindication for the use of an intra-aortic balloon pump, IABP? A. Severe aortic regurgitation. B. Acute myocardial infarction. C. Cardiogenic shock. D. Chronic heart failure. Answer: A. Severe aortic regurgitation. Explanation: severe aortic regurgitation is a primary contraindication for the use of an IABP because the balloon inflation during diastole may worsen the backflow of blood into the left ventricle, which can exacerbate the condition. IABP is commonly used in conditions like acute myocardial infarction with cardiogenic shock but should be avoided in patients with severe aortic regurgitation. In a patient receiving mechanical circulatory support, what is the most common reason for thromboembolic events? A. Inadequate anticoagulation therapy. B. Device malfunction. C. Underlying cardiovascular disease. D. Infection of the device. Answer: A. Inadequate anticoagulation therapy. Explanation: thromboembolic events are a common complication of mechanical circulatory support devices, especially in patients receiving ventricular assist devices, VADs, or ECMO. Inadequate anticoagulation therapy can lead to clot formation within the device or the bloodstream, which can result in embolism. It is critical to carefully monitor and adjust anticoagulation to prevent this. What is the primary role of a ventricular assist device, VAD, in mechanical circulatory support? A. To act as a total replacement for the heart. B. To provide a temporary means of blood oxygenation. C. To assist with the pumping function of the heart and improve perfusion. D. To enhance kidney function in patients with renal failure. Answer: C. To assist with the pumping function of the heart and improve perfusion. Explanation: a VAD helps by assisting the heart in pumping blood, either partially or fully, in patients with heart failure. It is used to support circulation and improve perfusion, either as a bridge to heart transplantation or as a long-term solution for patients who are not candidates for a transplant. It does not replace heart function completely like a total artificial heart, TAH, does. What is a major limitation of using extracorporeal membrane oxygenation, ECMO, in patients with severe cardiac failure? A. Risk of hemorrhage due to anticoagulation. B. Inability to provide oxygenation support. C. Limited capacity to remove carbon dioxide. D. High incidence of device infection. Answer: A. Risk of hemorrhage due to anticoagulation. Explanation: one of the major limitations of ECMO is the risk of hemorrhage due to the necessary use of anticoagulation therapy to prevent clot formation in the extracorporeal circuit. While ECMO is effective for oxygenation and carbon dioxide removal, anticoagulation must be carefully managed to avoid significant bleeding complications, particularly in critically ill patients. Which type of mechanical circulatory support device is most suitable for long-term support in patients with chronic heart failure who are not candidates for a heart transplant? A. Total artificial heart, TAH. B. Intra-aortic balloon pump, IABP. C. Left ventricular assist device, LVAD. D. Extracorporeal membrane oxygenation, ECMO. Answer: C. Left ventricular assist device, LVAD. Explanation: the left ventricular assist device, LVAD, is most suitable for long-term support in patients with chronic heart failure who are not candidates for a heart transplant. LVADs are used to assist the left ventricle in pumping blood and can provide long-term support, either as a bridge to transplantation or as a long-term solution in patients who are not eligible for a transplant. TAH is typically used for patients who need total heart replacement, and ECMO and IABP are usually short-term support devices.